today. So we're going to utilize a little bit of laser therapy. That's going to bring the blood flow to the area and just help, increase with the healing time as far as that goes. And then we're going to use another tool. It's called the StimPod. This is a nerve stimulator specifically, and everything's controlled by the nerves. Like I talk about neurological obstructions, if they're anywhere in the body, they're going to change the way that we function. So just sit tight for a second. I'll show you what do I do. We're going to get the laser turned on, start stimulating the foot. So right here, we've got it on a pain setting, and we'll get that turned on, super powerful. And then we're going to start hitting it up with the StimPod, which is the other device. And we find the nerve, and once we find it, you're going to start to see a contraction of the muscles, or the things that are actually connected to that nerve specifically. So right here we're hitting one, and that causes like a plantar flexion. We're pointing the foot down, and then another spot we're going to do is going to hit a little bit more towards the top of the foot. But both of them are nerves that would supply this area of the skin, or that part of the foot, feeling for that pain. Once we get done, then we're just going to be off to the races, and hopefully, as it should be, decrease the pain by at least 50% or more, which is awesome to get quick results on the first visit. So now we're hitting the second point that helps out with the foot, or just other different pains and different things that are going on. But it gives me a second to kind of talk about exactly what this is doing. So with the StimPod and the pulse radio frequency stimulation that we do, it's actually affecting the mitochondria, which helps produce energy. So typically when we have an injury, there's an energy crisis. So we need more of that. We need more energy. And ATP is the energy molecule within our body. So the more we can help produce that, the better things are going to heal as well. Another great thing is that this is super awesome for neuropathy, whether it's chemo-induced or whether it's diabetic. And then even the ones that are related to like a disc bulge or herniation, we can help wake those nerves up and help them function better so that you get you out of that pain a lot faster.